So, Dr. Knott, when we first started talking, you said that heart disease is not caused by high cholesterol, and that just about blew my mind. This is a world-changing revelation that you reveal in your book. Let's talk about heart disease.
Right.
Where does this misconception come from in the first place?
The cholesterol myth?
Yes.
It comes from a study done by a fellow by the name of Ansel Keys years ago. It was a 6-country study wherein they looked at over 20 countries and he only found 6 that fit the bill, so he excluded all the rest of the countries that had high intake of fat and high incidence of heart disease. So the majority of the countries didn't have high incidences of heart disease, so he just disregarded those. That's called intellectual dishonesty is what it's called. It's a fraudulent study.
And do you believe this is what's still taught in medical school?
Oh, yeah.
This is what's still taught.
Always taught to me when I was in medical school, still being taught. There's a lot of people who believe very vehemently in that you should restrict fat from your diet. You restrict fat from your diet, you're going to be unhealthy. It's just that simple. We need fat in our diet.
So tell us, what are the causes of heart disease that you talk about in your book?
Well, diet is definitely one of the predisposing factors. If you eat a lot of carbohydrates, you're going to mess up your system. You get what's called metabolic syndrome. We already know that. It's been proven. And any low-fat guru out here that claims that low-fat diets prevent heart disease is really not looking at the issue properly. But a high carbohydrate diet will definitely lead to problems, because it increases your insulin. Your insulin blocks the formation of your short-acting hormones, the good short-acting hormones called eicosanoids, and you're in trouble after a few years. It's not instantaneous. If it was, it would be looked at very seriously.
Right.
The other thing is inflammation, which can be related to diet as well. The other thing is low testosterone in men. The other thing is low estrogen in women. All of these things have contributing factors. High blood pressure is also predisposing to heart disease, but you know, high blood pressure in many cases is due to low thyroid. So we get back to the same issues of treating the reason for the high blood pressure instead of treating the high blood pressure with a drug.
If you were a patient and you were concerned about heart disease, tell me what you should do to make sure that you're getting the right care.
Well, I'd ask the right questions. I would ask my doctor what sort of diet that he proposes. If he proposes the American Diabetic Association diet, you probably ought to turn around and walk out of the office, because that's over 60% carbs. Carbohydrates are the problem. It's not fat. It's carbohydrates that lead to the problem. Restrict your carbohydrates to 1/3 of your diet and you'll be okay. And you try to restrict your carbohydrate intake to the low glycemic carbohydrates, not the high glycemic carbohydrates, like potatoes and pasta and bread and things like that we all eat and love. But we have to restrict those. We have to be sensible. And you have to have protein every meal. I know the vegetarians won't agree with me, but it's the truth. We got to have some protein. The other issue is you got to have proper fat. The trans fatty acids, I would avoid those if I could. You know, the man-made fats and nice, pure-looking cooking oils on the shelves, I avoid that aisle. And I would rather use coconut oil or olive oil, things of that nature.